slides into it and have a discussion than anything else. So if you have questions, fire away. Secondly, there's some information up here for you if you wish to take it. This is a little bit bigger brochure that comes from UNMC that has information about all the health professions at UNMC. Medicine, pharmacy, nursing, allied health, which includes a number of the professions like physical therapy, physician assistant, clinical laboratory science, radiation technicians, all of those folks. College of Dentistry, even though dentistry isn't on the UNMC campus here, they're in Lincoln, they're part of the UNMC program. So if you're interested in any of those, this has brief information, contact information about it. This brochure is a little bit more specific about pharmacy. On the front is a picture of all of our first year students in their white coats. Have any of you ever heard of a white coat ceremony? You know what it is? Okay, you've heard of it? Well, white coat ceremony is our way to celebrate the folks that are coming in to be new members of our profession. These are first year students, they're starting pharmacy school the next day with the alumni buy each one of those students a new white coat because they will need those coats in school when they start doing clinical rotations. So it's a celebration of the achievements so far, it's a welcome to the profession, that type of thing. So you hear about that, other professions have them as well. Medicine, pharmacy, nursing, I believe, they all have white coat ceremonies. And that's what it is. It's a celebration and a welcome. We have two big parties, one when you come in and one when you graduate. In between is a lot of hard work, okay? So my point, this is for you if you wish. My business card is here. Feel free to grab that as well, and there's some pins here as well. But if you, at some point in time down the line, you think, I can't remember what that guy said, or I want to know more information, cards there, go ahead and contact us, okay? That's the idea, is to have, so you have this as a resource. As I mentioned, I became a pharmacist a lot of years ago, as you can tell by all this gray hair. But why? I had an uncle who was a pharmacist, and I was interested in math and science. I liked those courses. And it was his suggestion that, you ought to look at this profession. So I did, shadowed, found out more about it, and discovered that I liked it, and it's become a passion of mine for a lot of years. I've had a lot of opportunities to do a lot of things. And I encourage you to do the same thing. If you're interested in something, find out as much as you can about it before you get into it. Learn about it. Is this something you could see yourself doing? Is this something that would be a passion of yours? Because you don't want to try to do a health profession kind of halfway. It's not that kind of a job. It's not that kind of a profession that you can kind of do a little bit on the side. You really have to plunge in and be all in on it, if you will, and make it a passion. This is what I want to do to help my patients. Whatever that may be, but make sure it fits for you. That means you'll have a good quality of life out of you as well. Because when you leave work at the end of the day, and you feel fulfilled, like I helped someone, that type of thing, that's a doggone good feeling. It really is, to help someone. So with those thoughts in mind, I want to talk about a few things today, and then we'll do a little exercise over here. And you can, I'll preface it so you have an idea what we're going to do. We're going to compound products. Anybody know what pharmacy compounding is? What would compounding be? Mixing something together that isn't made. Basically is what it boils down to. Compounding something that isn't made. Today we're going to make high-cal ointment. Here's your ointment base. I prefer Pillsbury because it's creamy and smooth and all that stuff. It's something I can add for Pillsbury. But it works well as your ointment base. Okay? Your drug, your toxic chemical drug, food coloring. Okay? This may be play, but you can sample the results. You can take this with you today, and I don't know if it's going to be lunch or whatever, but that's your business. The thing about it is we wouldn't sample the product if we were compounding real drugs, obviously, right? We would not compound, we wouldn't guesstimate like we're going to today. But you're going to mix 2 drops, that's the dose. 3 drops, we kill the patient. We don't want any dead patients. Our job is not to do harm to patients, it's to help people, okay? 1 drop, would that be better? just as bad as overdosing. In cancer chemotherapy, where I worked a lot, underdosing, you don't help your patient at all. In fact, it might make them sicker and you let the disease progress. So it's always important to know your dose. So 2 doses, 2 drops of drug in your ointment base. I'll show you how we'll do that. And we'll have an inspection at the end to see whose product is good. Okay? But that'll be our compounding exercise. But you have to sit through my discussion first, okay? But feel free to ask questions as we go along, okay?
Oh, I think I forgot to plug it in.
Here, I'll just do this. As I mentioned, there's more to being a pharmacist. Oftentimes, this is what you see. You'll see an ad about a drug or a news story about pharmacy, and you'll see somebody's hands. You don't even see a face most of the time, but this is what you see. You see someone's hands doing this. Boy, doesn't that look exciting? When you do that. My point is, how many years of college education do you think it took to get pharmacist behind my name? How many years of college education, prerequisites in pharmacy school? Anybody have any idea? 6, I hear 6, 8, those are both right answers. Anywhere from 6 in some schools to 7 to 8, some places require a degree before you even go to pharmacy school. That's a lot of years of college education to do that. Would you not agree? My point is, it's not so much about counting and putting them in the bottle, it's knowing what they do, how they work, when they work, where they work the best, those types of things. And working with patients to solve issues. Let's say this tablet, okay? Pretty good sized tablet. Let's say this was ordered for a 2-year-old. What do you think? 2-year-old's gonna be able to take that? So what do? Bell cutter? Somebody else? Fluid? Make it smaller somehow or other, crush it, smash it, make it into a different formulation. Now I'm gonna throw a wrench in. Can't do that with this one. It has a special coating. It's something that irritates the stomach, so it has a special coating on it to get it through the stomach into the intestine before it starts absorbing. So we can't crush it. We can't make a liquid out of it. We can't make it smaller. What do? We work with the practitioner to suggest an alternative that the patient can take, that is available in a liquid, that is available in a smaller tablet or something, and we make sure we work with our patient. My grandson has a disorder where he has to take some medications. When he was 2 and 3 years old, this is what he would take. He would not take liquids. The assumption always is a little kid, it's liquid, that's what you always do. Not Justin, he won't go there. He won't take it. He has to have this. So we have to work with our patient, with our family to make sure we help them get what they need. Making sure patient can get the bottle open. You know these bottles with these caps that are designed to keep the kids out? Often they keep the adults out and the kids can get in. If you give them enough time, they'll get in these bottles. So you just don't want to leave them alone with the bottle too long, or they'll figure out a way to get in it. But the adults wind up, the bad thumbs and fingers start to go bad with arthritis and they can't open the bottle. So we want to make sure our patient can get access to numbers. Do they know how to use it? Before I do that, here's an example of compounding a drug. We won't get this fancy today, but these are basically they're gummy bears. Gelatin troches, liquefied and poured into this mold. Now somebody did a great job, very, very good job in terms of the colors and all of that. But the idea here is you can peel this out. You can have medication in each one of these. So in the liquid part of it, you have the right amount of medicine in each. So that when you pour this mold, each one of these gets the right amount of medicine for me when I'm ready to take it. I just stick it in between my cheek and gum, let it dissolve, and as it dissolves, well, there's blood flow through here, through the cheek and the mucosa, and it'll be absorbed through there. So if I'm a nauseated cancer patient that can't take any medication, this is a way for me to do that. It might be a way to help my patient without having to inject everything and do things a little bit differently. So to deal with nausea, to deal with pain, to deal with a sore throat and radiation, and so on down the line. Working with your patient to help them be able to take a medication in a more affordable or in a more making sure patients know how to use a med. Here's an example. You may recognize this, an inhaler. Okay, this is probably one of the most misused devices that it's out there. What if I had a patient who thought this was the way to do it? Now, why are you giggling? You don't think that'll work? Not so much? Where's the drug supposed to go? Down here, right? How much is going to get there when I shoot it up in the atmosphere? Probably not much. But my point with that is, number one, the patient isn't getting much benefit. And number two, what happens next? Patient goes in to see their doctor. Doc, I'm having trouble breathing. Well, how's your inhaler? Aren't you using that? Yeah, I'm using it. This thing doesn't work. What's the next question that should be asked? How are you using it? Show me. But is that always asked? And I'm not trying to blame any practitioner, they're busy and all that, but the assumption is the patient has been instructed how to use it. So what happens next? Up the dose when not necessary, or maybe add another drug. So instead of 1 puff, they say 2 puffs. Well, now we're shooting 2 puffs in the atmosphere instead of 1. Or we're getting another inhaler, all of which because the patient wasn't using it correctly in the first place, or didn't know how to use it correctly. So my point being is, you can be adding additional drugs, additional expense, additional potential for side effects, because this wasn't used correctly or the patient didn't know how in the first place. So I want to be sure we help our patients to maximize these expensive and powerful drugs, just to make sure they understand. If I were to say, take 1 tablet 3 times a day, what does that mean to you? Breakfast, lunch, and dinner, okay? Would everybody agree that's a reasonable plan? Except you have to be careful what you tell the patient. I've had a patient say, well, I'll take 1 at 9, 1 at 10, and 1 at 11. That's 3 times in a day. And you'd be right. I've had patients say, I'll take all 3 at once. That's 3 in a day. They added everything together. Not exactly, again, what we have in mind, so we have to be clear. Is it morning and night, with food, without? All of those things come into play. So medicine, it seems simple sometimes, but it's not that simple. So we want to be sure that our patients get the best and the most they can out of everything that we do. So a lot of what, like I say, there's more to it than just counting pills. Making sure patients know about prescriptions and over-the-counter products. Those things that you can buy in the grocery store or the drugstore. Adding those to what you're taking, the prescription medication, can cause side effects, can cause interactions, there can be other things happen. So sometimes over-the-counter is all one needs, but we want to be sure. Working with other healthcare practitioners. Pharmacists are part of the healthcare team. At the hospital, that was one of the favorite parts of my working in that environment, was working with the other members of the team. The doctors, the PAs, the nurses, the dietitians, because we had cancer patients who needed nutritional support a lot of times, physical therapists, all of those people are involved in that team. And we all bring our area of expertise to the table to help the patient. A whole team of people can help a patient maybe better than a single person can. Not that that single person doesn't care, but they just may not have all the expertise in it. And then composition, we talked a little bit about that tablet. What's its formulation, how can it be used, how should it be handled and treated, that kind of thing. So it's important to have all those factors in place. You know, we talked about dispensing medications, but anybody think about, this is another way of dispensing, administering the drugs. Giving flu shots. These are 2 of our students, the past students, going through the immunization certification class. You know that you can get a flu shot at a drugstore or grocery stores that have a pharmacy. So administration of medications is helpful as well. In this case, administering flu shots, we believe, has helped expand the number of people who actually get flu shots. And it's not too late still to get a flu shot, even though it's March. I keep hearing from the CDC and stuff, it's still not too late. So if you haven't gotten one, go ahead. Here to our students, we have one of our College of Nursing faculty observing here to be sure the technique is right. Obviously, if you were administering something, we want it to be done right. We want it to be done in the right muscle, at the right depth, and everything is absolutely correct. Patient safety is always an issue, or always a concern. What does that say? Right here, can you, and then it starts to trail off. And you're right, it becomes more difficult. It says, can you read this? But the read is a little fuzzy, and it's pretty darn hard to see THIS out of it. This, it's supposed to be a question mark, and I've had somebody say it's a Wi-Fi symbol. I've had somebody say, tell me it's a parachute. So it's hard to say, but the point being is we have to be careful. We can't just guess. Oh, it looks like it says, can you read this? But what if this were a number, a dose of drug, 250 versus 500 versus 1,000? What if we were guessing on that part, just filling it in ourselves? So we have to be sure we get the right dose for our patients and make sure that it's the right medication. Here's a little practice on interpretation of a prescription. Here's the name of the drug. You can buy this over the counter in the grocery store, the drugstore. It's an over-the-counter product. That's the name of the drug. This stands for one, so take one of them like those tablets. PO means by mouth, so the tablet that you swallow. Q is every. D, daily. Number 30. So one of these every day for 30 days. Can anybody tell me what the drug is? Any guesses? Does it help if I tell you this is an M, not 14, not LY, it's an M. Now any guesses? M-U-L-T-I, multi-vitamin. M-U-L-T-I, these are kind of run together, V-I-T-A, and then M-I-N. Can you see them in there? Sort of, some parts of that. It's still kind of hard to figure that out. But this is actually fairly well written. I'm sure if some of you have ever gotten a prescription, you see what looks like Greek on some of them. It looks like a bump in the line. And that's often what we get. But we need to be able to interpret that. And if there's any question, we work with the practitioner to be sure it's right. So patient safety is always something that's on the forefront. There's too many chances for making mistakes, and we want to be sure we minimize them as much as possible. If you're thinking about becoming a pharmacist, one of the things to consider is, if I go that route, can I get a job? Because you do want a career that you can have a job in, for sure, right? But there is a strong demand for pharmacist services. If you look around and see the chain pharmacies, there's chains, you name it, everywhere around this town at least. Smaller towns may not have as many, but that's still a service that'll be there. Hospital pharmacies, and I'll show you there's a variety of different settings. But a lot of the strong demand is driven by the baby boomers. You guys know what baby boomers are? When were baby boomers born? Any ideas? Even a little bit earlier than that, some in the 50s. Actually, I'm a baby boomer, born right after World War II in the mid-40s. A lot of people, after the war was over, okay, now we're going to start a family. So thousands of people. Do you know how many people are turning 65 every single day now? Over 10,000 are turning 65 every single day. And that will continue for the next 5 or 6 or 7 years. That's a lot of us out there getting to be that age. The thing is, many of us are also living, we're getting older, all right, but we're dealing with more chronic diseases. More diabetes, you probably heard about the diabetes epidemic, high blood pressure, high cholesterol, heart disease, so on down the line, arthritis. Everything I mentioned there needs medication, right? So we have a unfortunately, perfect opportunity for pharmacists helping manage some of those medication therapy issues. So you can see there's demand so there was some information just became available within the last couple of weeks, U.S. News and World Report, the best jobs. Of the best jobs in the United States, the top 100, I'll zero that down to the top 10. 3 of them were in computers or data analysts, that type of thing. The other 7 were all in healthcare. Nursing, pharmacy, PA, doctor, dentist, all the way through that list. So healthcare and technology, those are where the top jobs, at least on those lists. And that's been sort of that way in the last several years. Pharmacists are typically about number 3 in healthcare jobs, number 5 or so in the top job picture, period. So you can see, you're looking at a decent, solid career, but with a lot of opportunities for working in different types of places. There's a number of career opportunities, and I use this as an opportunity. I'm going to go past this since this shows what the U.S. News and World Report showed. But you can work in a lot of different places. Pharmacy services can be provided in a lot of different places. You typically think of the community pharmacy like the Walgreens and the chains, the CVS, the Target, but the grocery stores, IV, bakers, those folks have pharmacies in those. And then it kind of goes on down to more different kinds of specialized areas. And there always is the chance for ownership, although not as many people do that today as in the past, but it is an opportunity to own your own business. The other big area is hospital. That's where I spent my entire career. But big hospitals here in Omaha, smaller hospitals in greater Nebraska and some of the smaller towns. But you're always going to have drug therapy going on where patients are being treated. And where do the drugs come from that they get that from? What kind of management is there? So looking at labs, making sure doses are right and all of that. I mentioned the aging of America, the baby boomers, long-term care facilities. All of those patients in there have medication therapy going on. How many of them, there's reviews of that are required. And then down the line, insurance companies, people getting care at home, working for government agencies like the Food and Drug Administration that reviews and approves some of the drugs that are placed on the market, and so on down the line. So you can see there's a lot of different types of settings, plus a lot of different shifts within those settings. Interested in working the night shift on a weekend, I bet you we can find you a place. So sometimes that fits better for people's family life, that type of thing. This gives you an example of what, I mentioned that counting tray earlier, but here instead we do a lot of things by computer. Robotics do a lot of the actual filling for you, so you're reviewing what's on the screen to make sure it matches, to make sure the patient's profile. Are they allergic to something? Have they had something else that duplicates what this new drug is about? Going on down the line to make sure the dose fits and all of that type of thing. So it's changed a lot in that environment. This can be sort of what looks more like in a hospital setting. That doesn't look very exciting, but what's happening here is that all the members of the team are reviewing a certain patient's medications and the situation for the day. This patient is in the hospital with an acute attack of pneumonia. They're on certain drugs. They're getting better. The cultures are getting better. Now their kidney function is not as good as it was yesterday. Do we need to adjust some of these doses and things of that nature? Should we continue certain drugs? All of those things come into play. And this could be the pharmacist, the dietitian, the physical therapist, the nurse, the resident, all the way down the line. It could be different members of that team. I pointed out earlier. So a pharmacy, I think, in summary, I look at it as it's well-rounded. There's a lot of different opportunities in it. It's challenging. It never stops changing. And any career that you enter, I would venture to say almost any career, you never stop learning. You're only getting started learning when you're in school to pursue that career. An example in pharmacy, aspirin. Aspirin, the oldest drug known to mankind, yet there are new uses for it. What's on emergency squads to be chewed after someone discovers someone has a heart attack? A small dose of aspirin. That's a new use for an ancient old drug that's been around for years. So as research guidelines change, they discover new ways of using drugs, that comes into play. If you're interested in helping people, any of the medical professions certainly contribute to that. You're helping people in some way, shape, or form. And that's an awfully good feeling at the end of the day to have felt like you've helped someone just a little bit along the way to maybe make their life just a little bit better. A lot of different places to work. I mentioned career opportunities, and that can range from dispensing pharmacists to but I've been fortunate enough to wind up in academia. It doesn't hurt to have a good earning potential in the process. Right now, the Bureau of Labor Statistics says that the average pharmacist salary across the country is about $110,000. So it's a decent wage. And lastly, it's a very trusted profession. And that, just a couple of words, right? But that means a lot. It's something we're very proud of, something that we've earned over several decades. The Gallup polls, if you're familiar with the Gallup organization, does polling. And some of their polling is about the most trusted professionals. Nurses are typically number one, pharmacists are typically number two. And that's a good feeling to be part of that kind of a group of people that when they ask for advice, they know they're going to get good, solid, accurate information. And that means we need to know what we're talking about. And that's why it takes a lot of years of education to learn it and be part of it. But can we know everything off the top of our head? There's just no way for 10,000 drugs to know all the parts that there is. So I emphasize over and over and over again, it's an acceptable answer to say, I don't know, but I'll look at it. And I'll get right back to it to make sure it's right. We can't guess. We wouldn't guess for our family member. We are not guess for a patient. We're going to get it right. So tough all. You want to be sure you're in it for the right reasons, and it's going to be something you're going to be passionate about at the end. So those are things to think about. With that in mind, let's do the exercise, shall we?